Hello, ladies and gentlemen. It's me, Aaron Sputeman, on the Diaries. Today's episode is COPD Catastrophe. I'm here with special expert Aaron Flem to go over it. So, Aaron, introduce yourself.
Hi, I'm Aaron Flem.
All right, Aaron, the first question. What is COPD?
All right, so COPD, it stands for chronic obstructive pulmonary disease. It's essentially a chronic inflammatory disease of the respiratory tract. Now, to put that in layman's terms, it basically means that you don't breathe so well. Your lungs are not able to take in very much air, and the air that does come in usually gets stuck. It's characterized by inflammation of the airway, so not really having enough room for the air to get down your throat, and then inflammation of the lungs as well. So
what does this stuff look like? Like, what sort of changes would you see in the lungs?
Oh, that's a very good question. Essentially this can present as some shortness of breath. So you can also kind of see it in some people. They have barrel chest, which is essentially a very broad chest. It looks like it's more of a barrel shape than a regular chest. It can present by wheezing. A lot of people have a cough that usually they cough up a lot of phlegm because there's also a lot of mucus in the airways that makes it more hard to breathe and more irritating to breathe as well. There's also a lot of people who have trouble exercising because they just can't breathe well enough during exercise. This is called dyspnea on exertion. Overall, it's essentially just inefficient gas exchange, which basically just means that the body can't really exchange oxygen very well for CO2.
I also heard that there's like two types of them.
Oh, yes. So the two types of COPD are emphysema and chronic bronchitis. So what emphysema is essentially is when the little sacs in your lungs, they get inflamed and essentially destroyed. So a little anatomy pop quiz. The way your lungs work is you breathe in down into the tube of your throat, and that tube separates into each lung, and that just separates further and further until it gets down to these little tiny sacs. And those little tiny sacs are where air exchange happens.
Oh, that's so cool.
I know, right? It's like a little upside down tree. So essentially, emphysema breaks down those little sacs, and instead of it being a tiny space, it gets larger and oxygen gets trapped inside of them. And the other one, chronic bronchitis, that is a condition where it is more characterized by the airways being inflamed and covered in mucus. And basically, this is just a thing that worsens because of itself. It's like a cycle. So essentially, the mucus causes coughing, which causes irritation, which causes even more swelling, inflammation, and it narrows the tubes even more. So it makes it harder and harder to breathe.
So what are some complications that can occur?
If someone with COPD gets some kind of respiratory infection, this can make breathing even harder. So if someone contracts the flu or pneumonia, it can easily hospitalize them.
All right. And what are some risk factors?
Risk factors. So there are quite a few. The main one by far is smoking. People who smoke are, I believe it is 20% of people who smoke get this disease.
Oh, wow, that's quite a bit.
It's quite a lot. 1 in 5. I do not like those odds. How about you?
I don't like those odds either.
Quite awful odds.
I would have better odds gambling.
You would. And secondhand smoke is a factor as well. So if you're even around someone who smokes, then that is going to lead to a higher likelihood of getting COPD.
All right. So
sorry, there are a few more risk factors as well.
Oh, sorry, I didn't mean to cut you off.
No, you're totally fine. There's essentially, if you work in a place where you're inhaling a lot of fumes, a lot of chemicals or dust, that is a likelihood makes it greater likelihood that you will get COPD. Or if you're exposed to air pollution, that's another major factor.
Oh.
And there's a genetic factor as well. If you get a certain gene that your parents had, you are also at a higher likelihood to get this.
Gotcha. That does not sound fun.
It is not fun. Yeah.
I don't envy those people.
I don't either.
So I guess on a more upbeat note, how is it treated?
Well, there's a lot we can do for this. Sadly, there is no cure for COPD. But what we can do is we can preserve the body's ability to breathe, the existing lung function, if you will, and we can slow the progression of the disease. Because I don't know if I mentioned before, but this disease is ever worsening. And we can treat these symptoms by respiratory therapy, so we can give oxygen. That is one of the most common ones. You can do lifestyle changes, so you can stop smoking. Vaccines are really important, so getting vaccinated for respiratory infections like, the flu. Surgery in some cases to remove a part of the lung that's incredibly inflamed. This is pretty rare, though. Or you can do a full lung transplant, which is also pretty rare, and there are a lot of complications. Yeah, quite interesting.
Wow, I can't imagine having someone else's lung in me.
I know. Well, there's a high risk of rejection, so it is a pretty rare procedure. But there are also medications, like there are inhaled medications you can take. This includes bronchodilators, which essentially open the airways. And then there are long-term and short-term acting bronchodilators. And long-term is better for COPD. It just works better because it's a chronic condition.
Oh.
Yeah, and there are steroids as well, which can essentially just treat inflammation.
Spooky. All right, well, we'll get some questions from our prying patrons right after this break. This June, team up with 3 other players to stop the stuck-up sorcerer with the power of enemas. You can take on 4 enema warriors. It's very cool. Wow. You can just take down enemies and just shove the enemas up there. Protect the town from being stuck up with constipation. You can even do left lateral if you pre-order the game. Coming June 25th, Enema Elysium. Now, we're back with our prying patrons. Donnie27 asks, what are some signs of COPD?
Well, Donnie Don, I'm really glad you asked. Actually, there's a difference between signs and symptoms. So signs are essentially objective findings and symptoms are subjective findings. So like I said, symptoms can be someone who's presenting with trouble breathing, chest pain, shortness of breath, trouble inhaling and exhaling, and wheezing and coughing and mucus. All those things are symptoms. But one way that you can see this objectively is in someone's vital signs. So by looking at what we call their SpO2, you can see how much oxygen is in the patient's blood. So ideally, we want this number to be 95% or higher. But in many people with chronic conditions like COPD, this number can be chronically low to the point where the body has adjusted to this low level of oxygen. So you might see someone at like 86% oxygen, which in your average person is very low and they would be having a lot of symptoms. But someone with COPD can be sitting up and look relatively normal. So this is essentially how we can tell objectively that someone has COPD.
All right, thanks. And then for our next question from Douglas69420, what is barrel chest? Is that one of them Pokemons?
No, no, Douglas, this is not, quote unquote, one of them Pokemons. Barrel chest is a sign of chronic lung inflammation. So essentially people with COPD, their lungs are overinflated for such a long period of time that it actually changes the shape of their chest to be like a barrel, like just this big, broad, rounded shape.
And then finally, Pent Up Johnny 57 asked, what groups are most affected? Oh, wow. Will my stupid racist grandfather die from it? I want my share of the will pronto. That seems like you have some family issues there, man, that you need to solve elsewhere. But we can answer the groups for you.
Yeah, that was a lot, Pent Up Johnny. Well, what groups are most affected? People who are over 40 are more likely to have this, and men are more likely to have it, but women are actually more likely to die from it, which is interesting.
Well, folks, thanks for the questions, thanks for watching, and we'll catch you next time on the Disease Diaries.